Okay, good morning, everybody. My name is Dr. Will Ponsonby, and I'm chairing this meeting this morning. So I'd like to welcome our two speakers, Dr. Bethany Taylor and Dr. Peter Allmark. The genesis for this meeting came when I attended an all-parliamentary party group for asbestos at the House of Commons, and I ended up sitting next to Bethany, and she was explaining to me about some of the research work that they'd been doing in Sheffield. And I have to say that I was quite surprised, because my impression was that we had reached the peak of asbestos. Now that it was all controlled in society, no one was being exposed, and therefore we expected the kind of the numbers of cases of mesothelioma to start decreasing in coming years. And she informed me that that was not the case, and that they had evidence that people were being exposed in public buildings, hospitals and schools, and that these exposures were going to continue to cause mesothelioma going forwards. So I thought it was very worthwhile bringing them to help to explain what the research they were doing and the results of that research on asbestos in society at the moment, and the results that that will be having on the health of workers going forward. So I'll just introduce them. Dr. Bethany Taylor is a research fellow based at the Mesothelioma Research Centre at the University of Sheffield since 2016. She has a number of studies, which I'm sure she'll be explaining to us as we go through the presentation, and has an interest in seeking to understand the experience of people with mesothelioma following exposure in non-traditional environments, such as the public buildings. Bethany's research seeks to learn from the experience of patients, family members, and health professionals to improve the understanding of asbestos risk and to shape service provision and care delivery. So welcome, Bethany. And then your co-presenter, Dr. Peter Allmark, is also a research assistant at the Mesothelioma Research Centre in University of Sheffield since 2016, and has worked on, I assume, the same studies as well, and is also interested in patient and family care experience of receiving a diagnosis of mesothelioma and engagement of palliative care. Has a research background in philosophy and healthcare ethics, and has worked in extensively in the area, for example, studies into informed consent. So welcome to both of you. It's a fascinating subject, and we're very interested to hear more about it.
Thanks, Will. It's good to see you again. We're really pleased to be invited to talk to you today. So I'm actually at a conference today, and I found a quiet corner, but I'm really hoping there will be no interruptions, and apologies if there are. Okay, so we're doing a bit of a double act. Peter's going to share his screen. Thanks, Peter. As you know, we are both from the Mesothelioma UK Research Centre. We're based at the University of Sheffield, and we're funded by the national charity Mesothelioma UK. Our research focuses on the experiences of people affected by mesothelioma. And so today, to give you an overview of what we're going to cover, we're going to introduce asbestos and mesothelioma, going to give you a brief insight into the current policy context. We're going to explore the underestimated risk of asbestos exposure in schools and hospitals. And then we're going to think about what that means for mesothelioma patients today. And we've got time for a Q&A at the end. Okay, so what is asbestos? It was referred to as the miracle mineral. It is resistant to high temperatures, meaning it was valued as a fire retardant and heat insulating material. Here in the UK, we were the biggest importer in Europe. Asbestos was banned in 1999, so it hasn't been allowed to be used since then, but still remains in many buildings that were built or renovated before 1999. Asbestos is the UK's #1 cause of work-related deaths. It is carcinogenic, and it has been linked to numerous health conditions, including asbestosis, pleural plaques, cancers of the lung, the larynx, ovary, and of course, mesothelioma. So Mesothelioma is an incurable cancer caused almost exclusively by asbestos exposure. It primarily affects the lining of the lungs, and we call this pleural mesothelioma, but it can also affect the lining of the abdomen, called peritoneal mesothelioma, and very rarely other linings of the body, such as the heart or the testes. It is rare, with approximately 2,700 new cases each year. And while mesothelioma is a global burden, the prolific use of asbestos here in the UK means we have the highest recorded rate of mesothelioma in the world. Mesothelioma is a devastating disease, really high symptom burden. Symptoms include fatigue, chest pain, cough, shortness of breath, weight loss. Patients and their families have unique information support needs due to the cause of asbestos exposure, but also because symptoms can present 15 to 45 years after that exposure, which can be difficult to comprehend. And the fact that it is preventable for patients is also very difficult. There are also financial and legal implications. So because mesothelioma is identified as an industrial disease, patients and their families are entitled to compensation. And when a patient dies, the death must be referred to a coroner for investigation as a legal requirement. So mesothelioma is incurable. The majority of patients die within 12 months of diagnosis. It's a very complicated diagnosis. Sorry, Peter, next slide. We talk about 3 waves of mesothelioma. So the first wave being as a result of workers handling that raw asbestos material, mining it, working with it to produce asbestos-containing products. The second wave occurred as a result of workers using these products. So industries known for asbestos exposure include construction. It was a very popular building material. Power stations used it to insulate and fireproof equipment. In shipyards, it was used to insulate boilers, steam pipes. In the railway industry, even the paint used to spray carriages contained asbestos. So then we have the third wave, which is what we're going to focus on today. And this is due to environmental exposure to asbestos in homes, workplaces, and public buildings that still contain asbestos today. And this asbestos is now degrading in condition and is an increasing risk to public health. Okay, so the risk of asbestos is receiving increasing attention in the media and in politics. April 2022 saw the publication of a UK Parliamentary Work and Pensions Select Committee report into the health and safety executive's approach to asbestos management. And this report argued that the status quo was unacceptable and that there was a risk to public health if nothing changed. So they made several recommendations concerning future management of asbestos, and these included 1, the development of a national asbestos register to ensure accurate recordings of asbestos in buildings, and 2, gradual removal of asbestos over the following 40 years, prioritising buildings that are most at risk, such as schools. I'm going to hand over to Peter now for a little while. Oh, you're on mute, Peter.
Of course I am. So following that report and recommendations, the government initial and fairly quick reaction was to reject the recommendations, and this was then followed by a petition asking for 2 of the recommendations to be put in place. One was the central register and the other was the phased removal. Because it received over 10,000 signatures, it was had to be addressed by Parliament, and in the parliamentary reaction to the petition, there was a bit more argument on why they rejected it. I'm not going to read this out, but the key bits of it are the idea that removing asbestos is a greater risk than managing it in situ, and the current policy is one of management in situ unless the asbestos becomes exposed and dangerous. So asbestos in schools, hospitals, other public buildings is managed in situ with an annual asbestos report being kept by by the school or the hospital or whatever building it is. And it's saying that there's compelling evidence that there is no compelling evidence at the moment that removing the asbestos will reduce risk to building users compared to the risk of actually removing it to those who do the removal. Now, there are a couple of problems with that. One is this thing about research studies carried over several decades, which they don't provide any references to, and which people in the asbestos removal industry raise doubts about, particularly as their techniques have got much better over time. The other thing that I'm going to address in this section of the talk is the idea that there's no evidence in terms of reduced risk to building users. And the main point I'm going to make is that the number of building users who are being counted is far, as having developed mesothelioma, is far lower than the actual figure, and that there's quite a lot of data to show that the figures that they're using are wrong. So the figures that they're using are based on ONS data of deaths by mesothelioma, and this is collated in various ways, and one is by groups of workers, and you can see that one of those groups is health professionals. These are what they call sub-major groups, health professional, and the other groups are teaching and educational professionals. So there are 25 of these different groups. And from this data in 2009, Julian Pito, who's a professor of epidemiology, now emeritus, I think he's Sir Julian Pito, but he concluded that hospital and school workers school professionals were both in low risk groups based on this data. So you can see in the period 2001 to 2010, which is the period he was looking at, there were 25 deaths of health professionals and 232 deaths of teaching and educational professionals. And putting those in rankings with the other 24 groups, you can see that health professionals is right down the bottom, just one from the bottom for men, and 9th for women. Oh, sorry. So I'm looking at 2001 too. So that it's 23rd for men. It didn't actually give the ranking for women, but it would have been low with only 4 deaths, and 12th and 11th for teaching and educational professionals. Since then, the figures have changed slightly, and Pito has noted this in particular, which is the fact that female teaching professionals are now the top group of the 24 groups for mesothelioma, for risk of mesothelioma. So they've come up the rankings, well, a very long way, and that's certainly of concern. And this is even on the ONS data, even based on the ONS data, there's some suggestion that the risk to, at least to teaching and educational professionals, is on the increase. But the bottom line, according to ONS data in this period of 21 years, is that health professionals are dying at a rate of 7.2 per annum, and teaching professionals at a rate of 22.9 per annum. As I say, this puts health professionals in a low category of risk, but there are concerns about this data, and this is these are some of the things that we want to cover. I'd take you to the quote at the bottom first. that from Robin Howie, who says even on the basis of the ONS data as it stands, teachers and nurses, the risk to teachers and nurses is higher than other occupational groups, and there are sort of statistical reasons that he gives that for that. So I'd say that even with the ONS data as it stands, there are some people who think there is cause for concern anyway. But I'm going to sort of leave the ONS data to one side for a minute and look at other things. The problems being with the ONS data, amongst other things, is that it only covers deaths up to the age of 75. So if a former teacher dies of mesothelioma after that age, then their last employment won't be covered. Key point, I think, is that it doesn't cover ancillary staff. So many of the people, particularly in hospitals, there's a huge number of people who work who aren't health professionals. So various technicians, cleaners, porters, and so on are not covered in that data. So, and some of those might be in groups that we would expect to be more likely to be exposed to asbestos in hospitals, say porters and cleaners, for example. And the other thing is it only covers your last employment. So if, for example, a nurse changes employment at the age of 50 and goes into another area, perhaps after having children or whatever, they won't be, and they then develop mesothelioma, they won't be covered by the ONS data. So there are various reasons for being concerned about the ONS data. And for this reason, we put in, and others have put in as well, a number of freedom of information requests to see if we can get figures from other sources that might give us a better idea of deaths that aren't covered by the ONS. And this next slide will sort of take a bit of talking through. You can see at the top there, I'm looking at health and education. So I'll start with the health data. And remember that column E there is the ONS data. So that's giving us about 7.2 deaths per annum. Now, the first freedom of information request that we put in was to NHS Resolution. And this is the body that deals with legal claims against the NHS and collates those. So we asked them how many claims they'd received from former workers who've developed mesothelioma, and they gave us actually the wrong data first of all, but the corrected data when we received it was 251 over 6 years and 353 over 9 years. So this is giving a rate of 41 claims, between 39 and 41 claims per annum. A great deal of people who've developed mesothelioma and who worked in the NHS. So this is a great deal higher than the 7.19 figure that the ONS is giving out. And it's sort of speaking to legal firms, quite a lot of these will be people who aren't NHS professionals, but who worked in the NHS and believed that they were exposed to asbestos. These figures will be very much on the low side because most people who develop mesothelioma, if they go to a lawyer, if their former NHS worker goes to a lawyer, the lawyer has to be able to find a convincing case of negligence. It's not just a matter of showing that you worked in the NHS and had mesothelioma. You have to show that the place that you worked was in some way negligent in the way it managed that asbestos, and that's hard to do. So some of those cases there, they didn't win. We know they developed mesothelioma, they didn't necessarily win, about half of them did. And then there's quite a few that didn't even go forward because the legal firms will only take these on if there's more than a 50% chance of winning. So, and they would if, for example, a former NHS worker had a parent who worked in a high-risk industry, they would go through that risk route and say that they were exposed, possibly exposed as a child, to the laundry or whatever of their parents. So these figures, 251, 353, are on the low side. Nonetheless, they're a great deal higher than the ONS data suggests. The other thing we did was put in a Freedom of Information request to the DWP, the Department of Work and Pensions, and this is for disability benefit claims, industrial injury disability benefit. Most people who develop mesothelioma will be able to put in this IIDB claim, and you don't have to show that there was any negligence. You just have to show that you've developed mesothelioma, and plausibly it developed as a result of the job that you did. So most people who develop mesothelioma at the NHS, if they have time before they die, and unfortunately quite a number do die quite quickly after diagnosis, will put in an IIDB claim. And the DWP, their data is collected slightly and under slightly different categories. So I've had to play around a bit with the data on the basis that about of the 480 people in this category, human health activities, about 68% of those would have been NHS workers. So that's giving us a figure of about 65 per annum. And that's probably closer to the real figure because IIDB picks up most people who develop mesothelioma. It will still miss a few, but it will be much better than the ONS data. And it'll, as you can see, it's higher than the NHS resolution data as well. So that's the health data suggesting, almost a factor of 10. The number of people developing mesothelioma who've worked in the NHS is higher than the data given by the ONS. Turning to education, there we had a figure of 22.9. There isn't a single body like NHS resolution, so we weren't able to put in a claim that way. You can, an FOI request that way. So you have to do it through every individual educational authority or employer, and that's hard going. But it has. Some people have tried it, and again, it suggests high figures. But looking at IIDB claims, and here the categories used are primary education, general secondary education. These are what are called SIC, standard industrial codes. These are better than the ONS codes of health professional, teaching and educational professional, because they cover everyone who's worked in the industry. So if you've been a cleaner working in primary education as an industry or general secondary education as an industry, you will be counted in this figure. So this picks up people who would otherwise be missed. And here we're getting a figure of 350 over 5 years. So you've got a figure of 70 per annum. So again, much higher than the ONS figures for the amount of mesothelioma in former people who've worked in education, and as also for people who've worked in the NHS. So when the government responds to the committee by saying that the evidence is not there in terms of reduced risk to building users, they're doing it on the basis of ONS data, which we think drastically underestimates the number of people who are actually developing mesothelioma, probably as a result of exposure in schools and hospitals. Obviously, if with schools, there's another question, which is about former pupils. And here, the evidence is much harder to find there is no kind of, obviously being a former pupil isn't an occupation, so there's no collation of this. Everyone is a former, pretty much everyone's going to be a former pupil. But bearing in mind, you know, about 80 or 90% of schools currently have asbestos somewhere on their estate. If teachers and other workers are being exposed, then it's likely that pupils will be exposed. And there's I've said 4 points there. I've actually got 5 points suggestive of current and future risks to former pupils. So some of this is data we've collected, some of this is data from elsewhere. The one that we've collected is based on a questionnaire that we sent to 5 legal firms. Actually, it's more legal firms than that, wasn't it, Beth? But only about 6 or 7, something like that. How many? Yeah, 8. All right, okay. And we've had 4 responses. I think this is the data from 3 of them, but it may be 4. But anyway, it gives you a rough idea. So we had 90 legal cases in the period 2015 to 2023. Remember, this is only a small number of legal firms, so there'll be many more cases than this if you looked at all legal firms across the UK. But these are specialist firms, so they will get a fair proportion of them. Notice on that pie chart there that the large blue area is the area that the ONS would count. These are the educational professionals. All the rest wouldn't be counted in the ONS data, which may, you know, go some of the way to explaining why the ONS data is so awry. As you can see there, on that basis, again, you've got to say it's hard to win a case, and many cases wouldn't be taken on. So these are only cases that have actually been taken on. Some of them will won, some of them will not. But there have been included in there. You can see that there is 1 pupil in the 3 legal firms that we looked at. And there have been a number of compensation payouts to former pupils. There's a case called Diane Wilmore from 2011, which was the first case. But I've got some references to at least 3 others, and there are more than that. And the 3 others that I've got are not cases that are covered here. So pupils are suing on the basis of believing that they were exposed to asbestos at school, and some of them are winning. So we know that some pupils, very small numbers, are able to show that they've developed mesothelioma as a result of exposure to asbestos, which was also negligent exposure. Another thing you can look at is deaths in the under 40s, on the basis that if you die of mesothelioma in the under 40s group, you were probably exposed to asbestos as a child. Now, again, Julian Peto, who's the person I referred to earlier, the epidemiologist, in something that's not been published yet, noted a large increase in the under 40s from 2.7 per annum in 2008 to 2017 to 6.3 per annum. I was struggling to find these figures, but I eventually got it this morning. I worked it out this morning, and it is correct. And as this from an Italian paper says, early mortality from malignant mesothelioma is a proxy for childhood environmental asbestos exposure, and it deserves particular concern. So the fact that we have an increasing rate, quite noticeably increasing rate of deaths in the under 40s suggests that people are being exposed at school. The death, obviously, we've already seen the death rates in female teachers, and recall that as that highlighted in yellow says that the being a female teacher is now the sort of riskiest of these 24, 25 groups in terms of developing mesothelioma. If you put this on this is females. I'm not sure how clear this will be, but there's the bar for teaching and educational professionals, female. As you can see, just under 0.4% of all deaths of females in this period, 2011 to 21, were due to mesothelioma. The only other thing that comes close is elementary trades, and these are sort of building trades and the sort of areas that you might expect to be high risk. If you do the same thing for men, you've still got this one that stands way out. In fact, these two, over 2% of all deaths between 2011 and 2021 was mesothelioma of those who worked in the construction and building trades. Note that teaching and educational professionals, men, are still. Oh, are you hearing something?
Asbestos seminar. Very interesting, actually.
Yes, I can.
Neris Williams, I think we can hear you. So the teaching and educational professionals there, I'm glad you said it was quite interesting, actually. Although amongst men it's only like about 14th of the various groups, it's still running along at over half of over 0.5% of all deaths of men between 2011 and 21 were those amongst teachers. We also have some data, qualitative data that we collected and quantitative data that others have collected on the state of school buildings. The first two quotes were there are from studies that we did, which found, the first two from teachers, and obviously managing in asbestos in situ in schools is possibly not the same as managing in situ in other places, given the sort of behaviour of pupils. And those two quotes there sort of suggest, those board lessons where you sort of sit there with a compass boring a hole through the wall or whatever, that schools may be subject to more wear and tear than other buildings. And that last quote is from the Wilmore case, the first legal case of a pupil who successfully sued for exposure to asbestos as a child, leading to mesothelioma as an adult. And on the quantitative side, a couple of reports here. One is, well, this first one, the asbestos management, the AMAP report, is the one that told us that 81% of schools have asbestos present on their estate. This was in 2019, based on a questionnaire and a review by the Department for Education. This other report was done by a charity. Michael Lees here was someone whose wife was a teacher and who died of mesothelioma, who then sort of took on an asbestos in schools charity and campaign. That group found 291 failures of asbestos in schools, resulting in the release of fibres. I can't remember the period. I think it was about 2000 to 2014. But this was again based on freedom of information requests. The other thing we have is the ATAC and NORAC survey, and ATAC and NORAC are both asbestos professional groups, so dealing with asbestos in buildings, its removal and management. So their survey looked at 128,000 and nearly 129,000 buildings, some of which were public buildings, some of which were private buildings. Found 710,000 items of asbestos, a large percentage of which had some level of damage, and 24% had damage that required work by a specialist contractor. So this is finding that despite the fact that everyone who has asbestos on their estate is supposed to have an asbestos plan and manage it, the success of that policy is brought into question by this survey. The last thing, the fifth reason, so these are all sort of things where we might think pupils are particularly at risk in schools from any asbestos that it isn't being properly managed. The first thing was from a Department for Education. Again, they commissioned this report on carcinogenicity of chemicals, partly because of a concern about asbestos in schools. And this committee said that the exposure is likely to render them more vulnerable to mesothelioma than adults, partly because, as the second point says on there, the latency between exposure and disease is long. So the younger you are, the more likely you are to get it. But also, if you get asbestos fibers in growing lungs, they are more likely to develop mesothelioma than if the lungs are fully developed. Note that the risk doesn't diminish, unfortunately. It's not like giving up smoking where the risk goes off over time. Once you've been exposed, the risk stays the same and doesn't drop off as time goes on. And there are two sort of main models that we've been able to find. The one that's often quoted is from a late 1980s report by the USA Environmental Protection Agency, the EPA, and this report is still used by the American government as a basis for policy. But this estimated that about 90% of premature deaths due to exposure at school will occur in persons exposed as children. So for every 10 people who develop mesothelioma who've worked in schools as an adult, there'll be another 90 who will develop mesothelioma because they've been exposed as children. Julian Peto put in a slightly lower estimate in 2013 in a answer to a question in a parliamentary committee. But he was saying around 200 to 300 pupils would die each year from exposure to asbestos in schools in the 60s and 70s. And the Joint Union Asbestos Committee, the JUAC, put the two together and estimated that between 1980 and 2017, mesothelioma in former pupils due to exposure at school was somewhere in that range there, between about 4,000 and 9,000. So that's sort of at that point I sort of hand on to Beth, but with the main point being that the levels of mesothelioma amongst former workers in the various working in public buildings is probably much higher than is being picked up by the ONS. And with schools, there's the additional concern about pupils. And then I can hand over to you, Beth.
Thanks, Peter. Okay, so at the Research Centre, we've got quite a few studies that give insights into the patient and carer experience, those affected by mesothelioma, but I'm just going to draw on extracts and insights from two of these studies today, each developing understanding into the experiences of mesothelioma patients exposed to asbestos in non-traditional environments, so working in schools and working in hospitals. And those two studies are the Mesothelioma Asbestos Guideline Study, which we call MAGS, named after Mags Portman, a consultant who died of mesothelioma in 2019, aged 44, after exposure to asbestos during her medical training. And this study explored the experiences of presentation, diagnosis, treatment and care for healthcare staff with mesothelioma. The study comprised stakeholder consultation, a literature review, a freedom of information request, and 7 qualitative interviews. Then we have Muse, the Mesothelioma and Education Workers Study, and this one similarly explored the experiences of presentation, diagnosis, treatment and care, but for current and former school-based education workers with mesothelioma. And Muse had 3 stages, so stakeholder consultation, a literature review and analysis of national data that included freedom of information requests, trying to generate an indication of incidence of mesothelioma amongst school-based education workers. And findings showed that the current estimate of health and education workers diagnosed with mesothelioma is a gross underestimate, and also provided insights into the experiences of these patients and their families. The studies generated recommendations for clinical practice, future research and asbestos management, and further detail about both of these studies can be found on our website. So next slide, Peter. So thinking about how what do these studies tell us? How does what we've spoken about today, the underestimated risk, what does that mean for the experiences of patients and their families living with mesothelioma today? And both MAGS and Muse highlighted 4 issues really. So these were low index of suspicion, distress and shock at diagnosis, concern for others and the ongoing risk, and inequalities in accessing compensation. So I'm going to talk through each one of those briefly. So first one being low index of suspicion. So there can be immediate suspicion of mesothelioma when a person who presents with symptoms typical of mesothelioma has worked in an industry associated with asbestos exposure, such as a mechanic, a shop fitter, somebody who's worked in railway maintenance. So people who have worked in industries not traditionally associated with asbestos exposure, such as hospitals or schools, are less likely to trigger timely suspicion. Similarly, as the industries known to be associated with asbestos exposure are dominated by men, women generally may be viewed by services with a lower index of suspicion. And while there remains a need for more research to explore this, the qualitative data that we have does suggest that this is the case. And such low index of suspicion led to perceived delays as in diagnosis as people with a work history not typically associated with asbestos exposure, and particularly women presenting with symptoms, were not expected to have been exposed to asbestos. And the quotes on the next slide are from patients or mesothelioma patients who were exposed when working in a school, and they talk about misdiagnosis, disbelief that a person with their occupational history could have mesothelioma, and perceived delays in diagnosis. I'm not going to read them out to you, but to the next slide. We're thinking about that distress and shock at diagnosis, and it follows, therefore, that patients who have not worked in a known high-risk occupation are at more risk of high levels of distress and shock upon receiving their diagnosis, as these 2 quotes demonstrate. Next slide, please, Peter. Okay, so people unknowingly exposed to asbestos in an environment that was presumed to be safe spoke about a sense of injustice, that they were not kept safe when working to educate or care for the public. It follows that people who receive a mesothelioma diagnosis as a result of asbestos exposure in an environment not typically recognised as high risk are likely to have additional psychological and emotional support needs. They may require more time of healthcare professionals to understand and process their diagnosis. So there was great concern, and for some anger was experienced upon learning that the asbestos risk remains in buildings such as hospitals and schools, and the danger that this continues to present. And this can leave people with an additional enduring emotional burden that can be difficult to deal with. So mesothelioma is considered an industrial disease, and therefore compensation is available to those who were exposed due to their employer's negligence following the asbestos ban, as Peter's already talked about. And compensation can support families facing a loss of earnings, and also support patients to access non-NHS funded treatments to lengthen their lives. So there are clear advantages to being in a position where you are able to pursue a compensation claim. Next slide, please. So consultation with legal professionals that we've had during MAGS and MUSE has suggested that patients exposed to asbestos in an occupation not recognised as high risk are less likely to have that successful compensation claim. A lawyer usually has little problem in finding likely points of exposure for a client who has mesothelioma and has worked in a known high-risk industry, but it's more difficult to find specific cases of exposure that were due to that employer's negligence when the client is a teacher or a healthcare professional, and the employer may contest the case. There is a reluctance to take cases on when there is less than a 50% chance of winning. And this generates an inequality, so between patients exposed in a high-risk industry and those exposed in an environment not yet recognised to be high risk, such as a school or a hospital. So moving on now, I wanted to mention a newly released report that makes a valuable contribution to this debate about asbestos management and risk. So in November 2023, a cost-benefit report was published by Mesothelioma UK in partnership with stakeholders, and the report estimated that in 2023, the total cost to the UK economy of asbestos-related diseases among former school and hospital workers was over 1.3 billion. And considering asbestos removal costs only, the benefits of removing asbestos from schools and hospitals over a 10-year period, which is approximately 30 times faster than the current speed of progress, this cost would be 4.1 billion, outweighing the cost by a factor of 3. So for every 3 million saving, so for every 3 million spent, there would be 1 million. Sorry, wrong way around. This equates to 3 million saving for every 1 million spent on removal. That's it, I got there in the end. But if the building is what's called a system-built building, so when the fabric of the building is made by asbestos, the asbestos is too integral to the building to just remove it, as is the case for many schools. These cases require demolition rather than removal, and cases where demolition is required are much more expensive, and this reduces the cost-benefit ratio to 0.85, and this means that for every £1 million spent, the economy saves £850,000. So the net cost to the government over 10 years still remains relatively small at 2 billion, and in addition, much of this rebuilding would have to take place anyway when we think about the poor state of UK schools. The report states that there would be £11.6 billion saving to the UK economy over 50 years if asbestos was removed from schools and hospitals. And it's important to note that pupils and patients aren't included in this because there is so little data or no data, meaning that this in itself is likely to be an underestimate of the benefits to the public, and also that this analysis is based on a 10-year removal programme rather than the actual recommendation, which was 40 years. So we can see that there is now a clear cost benefit argument to removing asbestos from schools and hospitals, and this helps us to question the government's response to those recommendations. So a few take-home messages. Asbestos remains a risk to public health. Policy decisions are being made that are based on data that underestimates the risk of asbestos. People diagnosed with mesothelioma following exposure in non-traditional environments, such as those we've talked about, may face inequalities in accessing care and support that they need. And we must raise awareness of the risk of asbestos and campaign for its removal. Okay, so please do get in touch if you'd like to follow up on anything that we've talked about today. You can email both of us using the emails on the screen. We've got our website. Please feel free to visit the website, and you can sign up to the mailing list there if you want to receive updates about what we do. Feel free to chat to us on Twitter, and we have some time, I think, for questions if anybody has any.
Yeah, we've got 10 minutes for questions. So if anybody has a question to ask, please post it in the chat, and I'll read it out for you. First of all, I'll just kind of kick off with questions. I mean, one of the things that surprised me when I sat next to Bethany, we had a kind of a discussion of précis of some of the research, was the numbers of kind of healthcare workers, hospital workers and school workers who were presenting with mesothelioma. And my assumption, as I said in the start of the presentation, that this was due to very high industrial exposures historically, which no longer happen, and therefore we would see kind of mesothelioma slowly disappear. And that doesn't seem to be the case. Do you have any kind of data on exposure levels and you know, how much exposure you need to get a case of mesothelioma, or is it, as some of the lawyers say, one fibre is enough?
I think there are two elements. The more fibres you're exposed to, the higher the risk, which is why it's, you know, so high amongst the former building workers in the 1970s and 80s. But it does only take a very small amount of exposure to people who are vulnerable. Knowing who is vulnerable is difficult, but clearly, if all pupils in a school are being exposed to some level of asbestos, indeed, if all building workers are being exposed to some, but only a few are developing mesothelioma, there's a genetic component as well. So it's difficult to say, but the more there is, the higher the risk is, and you know, the more there is over a period of time, the higher the risk. But it's hard to quantify beyond that because it varies by individuals so much.
Yeah. Okay. We haven't got any questions on the chat. We've got one hand up from Tim Beaumont. Tim, do you want to ask your question? We can't hear anything, Tim. Still can't hear anything, Tim. Do you want to put your question in the chat, maybe? What, I mean, Bethany, a question for you. I mean, the evidence seems quite clear that we should be, your evidence seems to suggest we need to change the kind of recommendations by the Health and Safety Executive away from managing in situ to actually removing all asbestos. Is that what you're saying?
Well, that is one of the recommendations that was put to the government, to remove asbestos within the 40-year period, but it was just outrightly rejected. But I guess we can build evidence to debate that. So, for example, the cost effectiveness of removing asbestos. We now have some data to suggest that it is cost effective to remove it, and then as Peter's demonstrated with the ONS data, we can show that the government were rejecting that recommendation based on evidence that doesn't truly reflect the reality of the exposure risk that people are facing in schools and hospitals. So it is quite an active discussion at the moment. We are so we're hopeful, but I think these things will take a lot of time, sadly.
Good. Tim tells me he's got his microphone working. So, Tim, do you want to ask a question?
Can you hear me now?
Yes. Loud and clear.
Fantastic. I do apologise about that. So I work as a policy advisor in HSC. So obviously, a lot of the things that you've been talking about are directly relevant to the work I've been doing. If you don't mind, just a couple of things I just want to make clear from the talk for the benefit of the other people on the audience. First and foremost, totally agree with your final bullet point. This is totally about reducing the risk of exposure and reducing mesothelioma in the future. And I think the debate, as you reflected, Bethany, that we're having at the moment is what is the most effective way of doing that? It's not a case of having a sense of trying to resist anything other than what is the best way of moving to Great Britain, which is asbestos-free and mesothelioma-free. So it's all about examination of the evidence we have in front of us and making a determination of what's the best way forward. Just want to make it clear, though, that the Work and Pension Select Committee put forward a number of recommendations. I think it was 14 in total, and there was only 2 that were not accepted as going forward. The rest have been accepted as going forward, and the government is doing everything we can to ensure that we are implementing those recommendations as effectively as possible. The use of ONS data as well. In HSC, we only use that really. Well, sorry, I won't say we only use that. The main purpose of looking at ONS data is to flag up for us where we think we need to direct a regulatory activity. So that slide you showed where the biggest data was associated with people working in the construction trades, That's why we focus a huge amount of our regulatory activity on licensed asbestos contractors and people who work in the building trades. We've got 2 current communication campaigns targeted at just those 2 groups of people, because they are the ones who are clearly at highest risk. And I think also that the main point, though, I just wanted to ask you about is what impact do you think duty to manage has had or will have on rates going into the future? Because duty to manage has not been around for that long, and even now most of the cases we are seeing of people acquiring mesothelioma are pre-duty to manage cases. So do you feel that there is a scope there for greater understanding of the impact that has had on us on mesothelioma and asbestos related lung cancers in the future? I think that's just a chance to make a couple of points, but also that would be my question about your feelings on the impact of the duty to manage on effectively managing asbestos. And incidentally, if you are in a school and the asbestos is likely to be disturbed by pupils, the law as it stands at the moment would expect the school to remove that asbestos straight away if that asbestos is likely to be disturbed by bags in corridors or compasses in classrooms. We're thinking more about the asbestos buried away in disused boiler houses as being an issue that we wouldn't necessarily be telling people to remove. So yeah, I hope that's got my question across. Thank you very much.
Yeah, and I think those are all fair points and ones that we'd acknowledge. I guess the duty to manage data isn't there yet, so we don't know how effective it will be. The management in situ, we do know, hasn't necessarily been that effective because of the number of legal cases that have won. And also just the qualitative research, we've got loads of sort of quotes from people about ceiling tiles and not very well managed removal of asbestos in a hospital and so on. So I can't answer your question about duty to management. I hope as well that it will be effective. And you're right. I mean, what we want is a future that's effective. At the moment, that the Mesothelioma UK and many of the unions are going with the Select Committee report and wanting the last 2 elements included in there. But this isn't, the policy, as we've seen, it's an expensive and one that will take some commitment, which is going to be difficult to find from governments that are not willing to pledge extra spending at this time. So we don't just, that's not the only thing we're concerned about. And we're certainly interested in educational materials. One of the things we've suggested is that all people moving into work in the NHS should be aware of asbestos and an asbestos plan. At the moment, that just doesn't happen to most nurses and cleaners and so on. When they go in, they have no idea of where the asbestos is and how it should be managed, what they should do if they see something that looks like an exposure. So yeah, I think that at the moment that's probably the main thing we can do. And so I agree with you as far as that goes. But at a policy level, it would probably, given that schools are, in such bad disrepair anyway, and that RAC is causing quite a lot of work to be done, asbestos probably needs to start to be addressed at least, and the removal of it.
So I think we're at the end of our time now. So thanks, Tim. That was a great question. Thanks to Bethany and Peter. A fantastic presentation and really interesting science. And I think it gives us all things to think about in our practice and managing exposure in the workplace. And also it gives us something to think about in terms of campaigns to make sure that workplaces and especially public buildings and public spaces like schools and hospitals are safe. So thank you to our 2 presenters once again, and I wish everyone else a good day. Thank you.